From laser hair removal, you can expect about a 90% hair reduction. We never say it's going to be 100% hair removal. That just isn't correct. Occasionally we have patients that may have 100% hair removal and 100% permanent hair removal, but we would expect about a 90% permanent hair reduction. The average patient needs about 6 to 8 treatments, but not everyone is average, so there are outliers. Outliers could be a patient with either very fine hair, where there's kind of a more difficult target for the laser, or a patient with very lightly colored hair, whether it be blonde, white, or red. Other things that could affect the hair removal and the hair growth process would be a hormonal fluctuation. So whether that be in women, pregnancy, menopause, potentially testosterone fluctuations. If a woman has facial hair growth that's potentially hormonally mediated, changes in hormones that can all affect our hair growth cycle and affect how we are able to remove hair with laser hair removal. With the 2 lasers that we have here at Plaza Aesthetics and Wellness, the wavelengths actually treat inflammation in the skin. So if someone has, a hypersensitivity maybe to like a gel that we're putting on the skin, then potentially they could have issues, but likely this is something that would improve their sensitive skin. We often have patients that will come in with maybe a folliculitis history where they may get an infection maybe after they shave, or they often get severe ingrown hairs causing pain, redness, discomfort. Usually within 1 or 2 treatments, the patients are starting to see a substantial relief in the ingrown hairs, or also the irritation that they get from shaving. And we would also expect to see improvement if someone had sensitive skin. Again, the only outlier to this might be we use an ultrasound gel for one laser. The other one we use a very fine, it's very similar to an ultrasound gel if someone had an intolerance to that, but it's water-based. That would be very rare. That wouldn't necessarily be an outlier. We do have men quite frequently that come in that no longer want their facial hair. They've shaved their facial hair their whole life, and now they just don't want to commit to that number of hours shaving. It's usually thousands of hours we even spend every year shaving. So it's nice to be able to have that permanent hair reduction. Actually, men tolerate that very well. It can be quite painful. Those hairs that are in a male face are often a little bit more painful to treat, but we would want the patient to be completely shaved day of treatment, and we would be able to treat the full area for facial hair, facial and neck. Men often will treat the back of their neck just because along their hairline, that can be a difficult area, between haircuts to shave or want to shave. So that's an area actually that we quite commonly treat. We'll have a patient get their hair groomed the way that they would like their bottom of their hairline treated, and then we would try to treat them within a day or 2 after that.